Dr. Whitley.
Yes.
How did you come in contact with OSB, and what were your initial experiences?
How did I first come in contact? I actually was getting nudged by my wife because I was disturbing her in sleep, and she had noticed that I was grumpy and literally had a kind of a hair trigger as far as anger during the day. And I was having a clearing of my throat issue that would bother her, and just ordinarily bothering her, so she was not liking my yawning or sighing all the time. And so I was having acid reflux during the day and also at night. Foods were bothering me. I was taking Rolaids. I also noticed I was having a lot of muscle pain. It was just kind of everywhere, moving around. So in addition to the fatigue, I was having muscle pain. I was having brain fog. I was having problems remembering things, short-term memory loss, anxiety, anxious, fearful. And so with that, I got a call from a friend, Dr. John Hart, who was telling me he was finding these articles in Second Opinion newsletter about a guy doing some very cool things with appliances out in Tacoma, Washington. And the more I listened, the more I thought it possibly could be something that would be helpful for me, but also for our patients as well as his. And so I went out and totally changed my life as far as how I viewed the problems I was having and how they were to be treated, and very successfully, and also how I'd treat the patients that I would be seeing back here, and was able to help a lot of Dr. Hart's patients.
How did it affect your symptoms?
Literally most of it went away, and as long as I'd wear my appliances, or orthotics as we call them, the symptoms would go into remission and wouldn't appear. And if I spent a lot of time not wearing appliances, eventually the symptoms would progressively start coming back.
And how has it changed your practice now that you've been doing it for several years?
I guess the biggest change has been that I view the patients when they come in totally different, because a lot of the things that I just accepted as, somebody was taken care of and watching, really what I was watching was their list of medications growing longer, and they were getting sicker instead of healthier. So I began to start saying, hey, I think one of these appliances might be of some benefit to you, and it's non-invasive. I mean, you're not taking drugs or surgery, and you can take it out. So a lot of patients were, I would say, desperate enough or interested enough to give it a whirl, and success breeds success. So we're having a lot of people look into this, and the best part is that not only were I able to help patients, but the staff benefited from it. They enjoy working with the patients. We have a better relationship with our patients, working at a different level.
You need to wear your appliances and have treatment yourself. Is there anything new you've experienced recently?
Well, one of the things as time's gone on, the newer technologies, the EKG and the pulse oximetry and heart rate variability and echocardiogram all reveal what goes on in this mouth affects the rest of the body, and affects it directly and indirectly. All the other systems are interrelated. So I guess the thing I've come to appreciate is just how wonderfully and fearfully we're made, and that what goes on in the mouth affects everything, every organ system, cardiovascular, neuromuscular, and so we have to have that working relationship with the medical community and our patients, so that we don't ignore something that somebody else is fighting a big fire, that we could possibly be of assistance in helping them regain their health and their well-being, their vitality.
Oh, this is sweet relief. I got a hope for life.